A very good afternoon to everyone. First and foremost, I would like to welcome you all in this session. Thank you for allocating your time and joining this conference despite your busy schedules. I feel grateful to welcome our guest speaker for today, Dr. Saida Ruksheda. Welcome, ma'am. Dr. Saida Ruksheda is an eminent psychiatrist and psychotherapist who serves as co-chair of Women's Mental Health Specialty and a section of Indian Psychiatric Society. She is also an executive council member of the Indian Association of Private Psychiatry. She is also an honorable secretary of Indian Association of Biological Psychiatry. She has authored many academic articles and chapters and is a keen teacher. She also trained in esteemed medical institutes of Mumbai, namely Lokmanya Tilak Municipal Medical College and Hospital with psychiatric training at GS Medical College and KEM Hospital, and received numerous international awards, including a prestigious WHO fellowship from South Korea in psychosocial rehabilitation. She has a thriving private practice in Lokhandwala, Mumbai, spanning over 20 years, specializing in adolescents, young adults, women, and families. She is also a celebrated speaker on mental health. She TED Talks to her credit, among various other media appearances. So now we request you to take over and share a few words with us, ma'am.
Thank you so much for that introduction. Bismillahirrahmanirrahim. Assalamualaikum. Good afternoon, everyone, because we've just crossed 12 p.m. At the outset, it's an honor and a pleasure to be speaking at your conference, and I've been in admiration of Alima Zahra for a while. So when she asked me to come today, of course, there was no question, and I had to say yes. So it's a pleasure for me to be here, and I always acknowledge my Lord Almighty. I acknowledge my parents, I acknowledge my teachers and my patients and my friends and my family, because we all learn every single day, and they keep teaching us every single day, isn't it? I'm asked to speak on mental health and gender sensitization because that's the theme of your conference. And I was wondering, and I was going through your list of different speakers, and I was amazed, and I was like, oh, after so much, what am I going to add, and how am I going to say anything that you guys already don't know? And so that was one aspect of for me. And the other aspect is that most of y'all are college students, and y'all are young people, and I'm in admiration of you and your generation, whether it's the millennials, whether it's the Gen Z, whether it's the ones in between, because I think you guys have done an amazing job in being gender sensitized to begin with. So I think that instead of us teaching you something, in fact we kind of need to learn a whole lot of things from you, because just the other day I was talking to somebody, and there's this young person, and it was said that, oh, my mother always dead names me. And I'm like, hold on, does your mother even know what dead naming is? And so the reply was like, yeah, I've explained it and things like that. So what I'm trying to say is that, that's why I love working with teenagers and young adults, because that keeps me kind of in the know. So frankly, when I'm thinking that, okay, what am I going to tell you? That's going to be a big task. So at the end of the session, you guys must tell me if I did a good job, and if there was anything new that you learned from me, and then you have to now start thinking, what are you going to teach me at the end of it? So when we're doing it on a virtual platform, it's not as interactive as one would like it to be. So I'm going to apologize to begin, or from the beginning, ki Baba, sorry, because I love talking about mental health, and gender sensitivity is something very close to my heart. So if I go on and on, if I bore you and I look as if I'm lost in my own thoughts and I'm just going on, so you're going to have to be nice to me and polite to me and not tell me that I was rambling on. But I do hope that the organizers let me know when my 40 minutes are up, because I do want to keep a lot of time for Q&A, because like I said, I'm looking forward to and eager to learn from you guys. For me, so like I said, when I was gathering my thoughts, what am I even going to talk about, right? And I said, let's just talk about what I've done over the last 10 days, right? Because with the run up of mental health, International Women's Day, and me being a psychiatrist, and me being associated and co-chairing women's mental health in the Indian scenario. So there was a lot of activity that we were going on. And, one would assume that, okay, there is so much to talk about women's mental health, but at the same time, one doesn't want to get repetitive. And thankfully, alhamdulillah, we didn't get repetitive. But before I start with that, I'm going to talk about something that somebody just asked me out of the blue something. And I was like, a girl is not a bad word, right? We have to not normalize saying that anymore. We can't say things like, don't throw like a girl, don't cry like a girl, all of that, because that's something that is stereotyping. And the problem with stereotyping is, whether it's for a girl, whether it's from anybody from the LGBT, whether, oh, you're so gay, or oh, don't be such a girl. So whatever it is that we are using, these terms are stereotypes. And these stereotypes are very limiting, right? So suppose if I am saying that, oh, don't cry like a girl. So not only am I limiting somebody else, but I am also limiting myself. And hopefully we can talk about that a little bit more later. But so I start off with this, that okay, on a daily basis, without even us recognizing, we use these words and expressions and terms that are really genuinely very damaging. They're not offensive because they hurt my sensibilities. They're offensive because they limit me as a person, and it also limits me as a healthy person, whether I'm talking about mental health, whether I'm talking about physical health. And frankly, there is no physical health without mental health, and vice versa. So when we talk about, and so we have to take that, we have to do that self-check. Do I do that? Ladki jaise mat ro, don't wear pink, why are you crying like a girl? Oh, you're behaving like, are you gay? So these kind of expressions is something that today, before we even start anything else, we're going to remind ourselves, okay, from today, I'm never going to do that. I'm never going to say it. The reason I'm saying it's limiting, right? It's limiting to me, is because when I have decided to stereotype somebody, then I'm not allowing myself to see that or that person or that environment or that world the way it is. I'm choosing to see that only in the way I am looking at it. So in a way, I'm lying to myself, right? And that's one thing that I don't want to do. If I lie to myself, I am going to put myself in danger, right? If I'm going to lie to myself that, oh, I'm not going to walk on the street, the cars don't exist. You know what? The car is going to come crash me and I'm going to die. Right? So the similar way, when I'm stereotyping somebody that, oh, girls don't drive, girls don't know how to drive, oh, girls are always emotional, oh, you're a sissy because you're crying and, be a man, kind of a thing. So when I'm stereotyping somebody, I am blinding myself. I am refusing to see anything else but this. So that is limiting to me. And as a psychiatrist, I am going to tell you, you have to start with you. We talk about self-care, we talk about you being you, we talk about taking care of yourself first, because that's what's important. The reason we say that is not because we want everybody to be selfish. No, in fact, we want everybody to be responsible for themselves. And and especially girls are kind of told and rewarded if they seem to be sacrificing, right? And that's why girls are, so many times they are like, oh, you're a goddess. I'm like, no, I'm a human being. treat me as a human being. Because the minute you put me up on a pedestal, it's very easy for you then to not care about what I may be feeling, doing, thinking, eating, drinking, right? That's why we need to kind of stop saying these words today. And the minute you hear somebody else saying that, all you have to do is say that, hey, that's not okay. I'm not asking you to get into confrontations. I'm not asking you to start fighting with them that don't say that and that's a bad word and how dare you. No. You don't have to do that. But you definitely also have to say that, hey, that's not okay. When you normalize even calling out like that, that's when it becomes more powerful. And when you make it so matter of fact that no, saying these things is, dude, it's not okay. And like I said, you don't have to outrage to outrage. And you don't have to outrage to bring about that change always. I'm not saying that if it gets into a debate that you shouldn't be heated or it can't be a heated conversation. No. I'm just saying that chalte in passing, just stand up for it and say that, hey, that's not okay. Right? So yesterday in one of our academic groups, a senior psychiatrist messaged in the group at the end of the day that, oh, how many ladies here have given their maids off on International Women's Day? And I was super offended because I'm like, he should have known better. The senior psychiatrist happens to be a he. And you know why? Because on multiple levels, this sentence is wrong. It's wrong that it suggests that only women run households and only because of that women may have maids and all maids are necessarily women, and also that women are the biggest enemies of women. All of these sentences are wrong, right? So of course I wrote back saying that I'm sure all of those households where the men participate equally in home responsibilities, because so that's why, like I'm saying, that young people are so much better at being gender sensitized, because I'm sure like a young person would have never made that comment, and this comes from a senior person, right? And the senior person is a good person and usually very open-minded, broad-minded and all of that, and clearly thinks that he's taking up for those maids working in the home, and clearly doesn't want those class divides to be seen that way. So his intentions are good, and nothing personal against it, but on principle these things are wrong. And that's why we need to stop making these comments. Even yesterday I was giving a lecture in AMU hosted by the psychology department there, and one girl asked in Q&A that women also behave like this towards other women and things. So this whole idea that women are the worst enemy of women is absolutely wrong. It's not even statistically proven. It's not even like an accurate sentence. And when it suggests that women are the worst enemies of women, that allows the other genders to kind of like not do anything and to whitewash their participation in that kind of oppression or the discrimination or injustice, right? And so so the answer that I gave this girl is that patriarchy doesn't spare any of us, and a lot of patriarchy gets internalized by women, right? Because it's just the system. So we feel that, okay, this is the system, this is right, this is how it works. We don't stop and question, we don't stop and notice that what we might be doing is also harmful. And if me as a mother-in-law is not being kind to my daughter-in-laws because my mother-in-law was not kind to me, it has nothing to do with woman against woman. It just has to do with, okay, I suffered, and somebody who suffered abuse in turn becomes abusive. So that's how it has nothing to do with gender, but it becomes gender because of patriarchy. And patriarchy doesn't serve well to anybody, but the biggest beneficiaries of that is the male gender. right? And so, but not to say that, like I said, it doesn't spare anyone. That's why boys don't cry. They can't wear pink. They'll get called names if they behave in certain way that doesn't seem very nice. And it's still easier for girls to stand up and say that, hey, that's not okay for you to, say to a girl. So if you see, this is not statistic, I'm just saying it. If you see 10 girls standing up for a girl, you might see maybe one boy standing up for a girl, right? So in that sense, not to say that, okay, boys can't be protective or men are not protective. I'm not saying that. I'm just saying, on that level. So that doesn't help anyone. And the reason that I am speaking as a doctor and as a psychiatrist today is, like I said, that limitation that we have based on gender roles, based on stereotype, comes, like I said, it impacts health, and it definitely impacts mental health, right? So statistically, we know that in our country, and frankly all South Asian countries, including Pakistan, Bangladesh, Nepal, we have bad statistics. Our girls, if they're allowed to be born, then they don't get the same kind of child care in terms of immunization, vaccination, nutrition. If there is one egg, the boy will have it, the girl will not get it, right? Simple things like that, but they're not simple, because what that does is, because when there is a girl child and a boy child, when they are at that age group, below 7, 8, 9 years of age group, they're similar in development, whether that's physical, cerebral, mental, brain development, and every level. So when you are already choosing one gender to not be equal to the other gender in terms of care, nutrition and medicines and everything, you're already kind of compromising this one gender's physical, mental health and development, which is again then going to possibly translate into inability to achieve their optimal levels in professions and careers and emotional health and relationship satisfaction, quality of life, and all of that, right? So that's why we want to not be stereotypical that, okay, girls need this and boys need that, and girls should play with this and boys should play with that. Because again, like I said, when I'm limiting something, I am not looking at reality. The gender stereotypes also continues later. I'm a psychiatrist. I know I work only in mental health. I know for a fact that if there is a lady patient with similar complaints, and if there is a male patient with similar complaints, patient A who's a female will probably get diagnosed ABC, and patient B who's a male will probably get diagnosed with XYZ, and vice versa. Like more women will get diagnosed with borderline personality disorder, not so many men, right? And more men, their depression might be overlooked, not so many women. Men will be asked about tobacco, alcohol, cannabis, opioids, all sorts of substance. Women won't even be asked about, because, she's a woman, why would she smoke and drink? So these kind of stereotypes become so ingrained that they also infiltrate the healthcare sector in terms of looking at a person, taking history, diagnosing, and then of course giving treatment. Even simple things like period pains, right? And period pains is something that apparently is supposed to be normal, and all women have it, and no woman should ever complain about it. So that stereotyping and that generalization, what it does is, it doesn't allow women to be able to take care of themselves. They themselves wouldn't know when to approach for help. I know I have patients who I'm like, oh, but this has been happening for 2 years. Why did you wait this long to go see a doctor? And they was like, no, I asked my friends or I asked my mom and they said it's okay, they said it's normal. But then finally I only couldn't bear it, and that's why I went to the doctor. You see, so these are real dangers if we are not going to be sensitive to each other's differences and not learn about each other. So everything that I'm talking about, this is not only for women. I hope more men are listening to it than women, really, because we kind of know all of this anyway, right? Because it's happening with us. These are our bodies and our minds and our lives. So what I'm hoping here is that if there are more women out there, go back today, say these kind of whatever you've learned or whatever something new that you may have thought about or whatever to at least one male gender, whether it's a father, brother, the watchman, the rickshaw driver. It doesn't matter who you're talking to, right? And or even if if you don't know somebody or you don't have anybody in your family or whatever, that's all right. Write it down. And if you're on social media, you can post it on social media. If you don't use social media, that's great. But write it down. Maybe you'll find somebody tomorrow to enlighten and educate, right? So this is something that all of us have to start doing. So like I'm saying, these gender stereotypes, they're harmful to us. They limit our vision, they limit our reality, they don't allow us to do the right thing. And as a professional or as an individual, of course I don't want to do that. I want to have my feet firmly on the ground, rooted in reality, so that when I'm doing my work and I'm living my life, I make the best decisions for myself and for others. Right? And I definitely need to know that, okay, if I am a woman and this is my body, this is my developmental curve, these are my requirements, then how do I best take care of myself? Right? And then I also tell the people in my house that, listen, this is what I need and this is what I want you to do. So that's something that all of us have to start doing. We can't wait for other people to be gender sensitized. No. We have to first get sensitized about ourselves, right? I always say knowledge is power. And the most knowledge that you have about yourself, the more powerful you're going to be. Because when you know more about yourself, that's when you can kind of decide what part of you or what quality of you can you use for your maximum benefit in this situation, right? So it starts from you, and you need to stop limiting yourself. I'm going to use these words again and again because I want them to really get etched into your brains, right? So when we talk about gender sensitization, from let's come back to pure psychiatry, diagnosis, disorders, and all of that, right? So when we're talking about what is a psychiatric illness, right? We have mental health. We all know what mental health is. Oh, I need to know. I chose to wear this scarf today because this is my favorite hijab. I love the color. I'm talking to you in English because I know that, okay, that's the language of instruction here. I remember to take my medicine in the morning. So all of that, the memory, all of that is mental health, right? That's mental health. And then I can have mental health issues that, oh yeah, there was a fight in the morning in the house and now I'm feeling a little low and I don't feel like working, but then I have to do this. So I'm going through some mental health issues. And suppose the fights have been going on for a week, and for a week I've been upset, or maybe my pet died, or I'm worried about somebody who's unwell in the house. So that can impact my mental health and I can have mental health issues. But when I have disorders, right, when I have a psychiatric disorder, and the most common psychiatric disorders are depression, anxiety, and the most serious ones could be schizophrenia, bipolar, OCD, and also substance. So what we know that why somebody gets a psychiatric illness is that it's a genetic vulnerability. Now, if I have genes which are maybe inherited from my family or they're my own genes, when I have these genes, I have more of a danger of having an illness, right? And then when there are other external triggers or internal triggers, I can then have that illness. So external triggers could be, yes, there's fighting every day, or I don't like my boss, or I don't have a job, or there is no money in the house, or, there's abuse coming from outside, I've been, being beaten up or whatever, unfortunately, all of that. So those are the external triggers. My internal triggers could be that, I have hypothyroid disorder, or my iron levels are low, or I have TB and now I have to take TB medicines, or I have malaria and I have to take malaria medications, or if I got COVID. So all of these are, my internal triggers that can then stimulate my genes and I can get that illness, right? So then when we were talking about that when I was younger and suppose I didn't get the egg and my brother got it, or I didn't get the vaccine but my brother got it, so then that means in my development time, I was not very strong maybe, right? So then again that can trigger my genetic vulnerabilities and I can have illnesses. We also, that's for everybody, right? But we also know that in women, illnesses, depression and depressive illnesses are almost twice as many as men, right? So if we see, it's almost twice as many. And so almost every woman, we have like a life, we have a risk that once in my lifetime I can get a depressive illness, right? So that's higher for women than men, right? And because, so what we need to, we need to be aware of these things so that we can take maybe protective and preventive measures. So when we are looking at psychiatric illnesses, why are women more prone to depressive illnesses? It's not so much because of the brain or how the brain functions, but it's a combination of biology, my neuroendocrinal development, because when I'm younger, 12, 13, 14, I'm getting my periods, every month my hormones are different, then when I am pregnant, my hormones are different, then when I deliver a child, my hormones are different, then when I have menopause, my hormones are different. So my body goes through a lot of different changes with a lot of different hormones, and that's part of my biology as well. And of course, like I said, genetically, men will have certain illnesses more than women, and women will have certain illnesses more than men. But we also know that the social problems, the external environmental triggers, like I said, are also a huge contributor to increasing this number of depression. And that's why also we want gender desensitization, because we know that one section of our society, in fact half of our society, can have a better life, and because they have a better life, we will also have a better life. Even yesterday I quoted this quote that women hold up half the sky, right? So if we are holding up half the sky, and suppose we are not doing so great and we are not feeling very well or we are unwell, that part of the sky is going to drop down a little bit, right? So that's why it's important for all of us collectively to help each other so that we are healthier as a society. And one of the ways that we can do that also is by learning more about what are the differences that we have, and in what way can we help each other, right? So it's important for us to again, think about gender stereotypes and gender discrimination, not just from a social point of view, but it impacting your health and then impacting the rest of your life. So, and when we were talking about depression in women, we know certain depressive illnesses are only possible in women, right? Like, let's say PMDD, that's premenstrual dysphoric disorder. So every woman will have a premenstrual time, but some of us will have a premenstrual syndrome. We will have physical symptoms like right now there's so much of bloating and parts of my body are like kind of tender and my back is paining and all of that, right? So those are the physical symptoms. From emotional symptom, I could have mood disorder swings, I could be irritated, I could be sad, I could just snap and get very angry. It could also have cognitive symptoms where I don't feel like focusing, I can't focus, I don't want to, I can't think, I can't come up with an idea, or I can't do problem solving. So a lot of women do go through PMS, and a lot of women unfortunately then also have PMDD. But if we don't even know that there is a disorder and we just stereotype and say, oh, all girls have PMS, and oh, is that time of the month for you? Is that why you're being so bitchy? I don't know if I'm French. Things like that. When we are stereotyping and kind of, negating an illness, how do we then even go about treating it, right? So we want to be aware of it, that yes, most women go through these changes, cyclic changes every month. Some of us will have some symptoms some of the months, some of us will have some symptoms another month. But if these symptoms are consistent and persistent and they're damaging me in a way that 7 to 10 days of every month is ruined because I'm just not feeling myself, that needs diagnosis and that needs treatment. If I was stereotyping myself or everybody else around me was stereotyping me, I wouldn't get that treatment. And I would be ruining my life and having interpersonal problems with my family or my friends or my colleagues. And I would have to shut down my business and probably get divorced and my children would hate me, right? A lot of things can happen. I know I'm exaggerating, but that's for effect because those things do happen, unfortunately, on a daily basis. And you know that women who are diagnosed with PMDD, they possibly have a diagnosis of depression or anxiety or both, even apart from PMDD. So a lot of the times women come to us with symptoms of PMDD and we end up diagnosing, okay, you do have PMDD symptoms, but that's because you actually have depression and anxiety to begin with. And during your PMS period, those symptoms escalate so much that with your everyday life, even then you can't ignore it. Because a lot of the times when we are running around, there's so much of work to be done, there's routine things, the work, 24 hours is never enough. Sometimes you don't have 5 minutes to sit down and just check. How am I feeling? How was my day? Is my body tired? Am I getting enough sleep? We don't even have that time to do the self-check. So a lot of the times that happens. So if you do think that, okay, there is a problem, we definitely want to, be more aware of these medical disorders, because psychiatric disorders are medical disorders. They're happening not because you're a weak person or, oh, there is just stress in your life. It's happening because your body, literally your, every tissue of your body is going through a change, and that's why you have these symptoms. Right? So when we see this, and then we see that, okay, just like with depression, we have that a lot of young, especially young women, will have a higher incidence of eating disorder. They'll have a higher incidence of NSSI. NSSI is non-suicidal self-injury, when we are there's self-harm. So these words can also be triggering to somebody. So if somebody in the audience is getting triggered by my using these words of eating disorders and self-injury, please reach out to somebody, maybe a colleague or maybe a teacher and a professional, if you find that you're getting triggered. So when we have depressive illnesses, these are also kind of like, let's say, either symptoms or comorbidities that we're looking at. And we know that PCOD is so common in women, right? Nowadays, unfortunately, every 10 to 30% of women have PCOD, polycystic ovarian disorder, or PCOS, polycystic ovarian syndrome. And we know that there is connect to the mental health system, just like there's a connect to the reproductive system and there's a connect to the endocrinal system. So when we have women with PCOD, they may then require more emotional health care, more mental health care, more psychiatric care. So if you do have that, just get it checked out that, oh, do I have these symptoms also, and do I have these symptoms also? When we do talk about suicide, because suicide rates are quite alarming in our country. Of course, our country is huge with our own sets of issues and population. So by proportionate, we also have a lot of suicides in our country. But what is unique to our country that we are finding now, very disturbingly, is there's a possibility that the world over, more men die of suicide and more women attempt suicide. But in India, we are seeing that more and more girls and women are also dying of suicide. And when that statistic kind of changes, we know that there is that is different from the rest of the world. We know there's something wrong here. We know there's something uniquely wrong here. And we need to now look into it more and take more corrective measures, because that kind of discrepancy is not okay. when we are looking at women and women disorders, definitely these are areas that we do need to focus. And when we talk about perinatal health, perinatal means while I'm pregnant and after I'm pregnant, right? So that's perinatal. But of course, we also include just before you're pregnant. Like I'm sure, any girl who comes to me and they tell me that, oh, we are going to get married, I tell them, you know what, start folic acid 3 months before you're getting married, because you may or may not have family planning, and if you get pregnant, you need that vitamin so that the child that you conceive will have a healthy first day of conception, right? In that sense, so we want to be sure that we're looking at women in the reproductive age groups with a different kind of care, because pregnancies, even though you are planning so much, it can happen sometimes that there would be accidental pregnancy. That would be very welcome, but you want to make sure that that's right. So when we talk about perinatal period, that's another area, time of a woman's life that is vulnerable, because there's so many changes happening almost every single day, body wise, social wise. If I recognize today that I'm pregnant, I have to start planning maternity leave, I have to start planning house help, I have to start planning childcare, I have to even start planning expenses, I have to do all of that. So social issues also change, financial issues also change, and my body is definitely changing, right? So when my body is changing, I'm more vulnerable to having depression and anxiety as illnesses. But if I don't know that, and if I feel that, no, if I'm pregnant, I can't take any medications, then if I'm unwell, I will not treat myself. And then what happens is, I'm scared to take any medications when I'm pregnant because I don't want that to affect the child in my womb. But what we don't realize is that actually, if I'm unwell, that's going to affect the child in my womb far more. That's why a lot of times when women who don't have blood pressure, diabetes, but when they get pregnant, they get blood pressure and diabetes. So the doctors give them medicine because they know that if the mother does have blood pressure and diabetes, that's going to affect the child, and the child is not going to grow in the womb. The same way, if a mother has depression and anxiety and that doesn't get treated, the child in the womb is not going to grow and may have low birth weight, may have other issues during pregnancy. Sorry. So this is again something that we have to be really aware of. And what helps is also social support, better lifestyle, all of that, just like for health, right? So suppose if I'm pregnant and I have diabetes, I'm going to be more particular about resting properly, eating nutritious food, going for a walk, not taking stress, taking my medications on time. You know what? If I'm pregnant and if I have depression, I have to do the same. There's no difference, right? So when we already know how to take care of our physical health, all we have to do is understand we have to do the same for our mental health as well. It's not different, right? I still have to eat well, I still have to sleep well, I still have to not take so much of stress, I still have to ask for help, I still have to take my medications if I need them, and all of that. So let's not worry and think that, oh my God, mental health is so much more difficult. Not at all. Right? And if it becomes on a daily basis that this is my routine, this is what I do for my physical and mental health, then it becomes very easy for all of us to manage. So when I deliver, I may be lucky and during pregnancy I'm fine, but maybe after I delivered I have depression, anxiety, or maybe even psychosis, then I definitely require medications. I may want to breastfeed my child, but you know what? That's fine as well. Because again, if I'm not okay, my baby is not going to be okay. Because even infants pick up on environmental changes. So if there are loud noises around the child is going to get psychologically impacted, and the brain development is going to get impacted. So it's important for us to kind of learn about these things. And like I said, not just for girls, but also for boys, because, they might have better access and resources than the women in their lives, and then they might be able to help the women better. So this is information that is important for everyone, because when I'm pregnant, I don't know if that my child is going to be a male or a female, isn't it? So then, of course, then I have to, I'm kind of like responsible for all genders in that way. So that's why it's important for everybody, not just women, to know about women's mental health. Because again, when we just think about, oh, women's mental health is something only women have to learn, right? That's again stereotyping, limiting, and impacting you, right? Like if my husband doesn't know that, oh, like, during pregnancy, she should do this, then he can't help me, right? And then later he might feel guilty that, oh my God, why didn't I learn about it before? Right? And one of the ways of improving perinatal mental health is for improved spousal support. And because, even if my husband and I are fighting, or when we are pregnant, yeah, sure, I'm carrying the baby, but the family kind of like the parent unit is pregnant. That's a time for a different kind of bonding and different kind of teamwork. So that's important for us, because if we don't look at mental health from that perspective, we will also just stereotype that, oh, men are not supposed to just be around only, and you don't need to come to the doctor, and you don't need to come to the gynac. No, maybe my husband wants to know what's going on with his child also, right? So it's possible, right? And in fact, and that would make me feel so much better. Listen, you come, I forget to ask the doctor, right? So that's all right. That's okay for us to do. And that's why also we don't want stereotypes, right? My mother-in-law does not need to come with me to the gynac. And frankly, nobody needs to come to the gynac with me. I can go to my doctor on my own. But it would be nice if somebody's there, right? And if somebody is there who actually is more genuinely kind of knowledgeable, then that's always better for me. So that's something that we definitely want to know more about. And when we talk about health and mental health in this aspect, and when you realize, like I said, by not making ourselves aware of other different kind of possibilities and issues, then we are all setting ourselves up for a harder time. And I always tell people that, why do you want to make anything harder for yourself? In fact, make it easier, right? So even in a maths test, that's what our teachers have taught us, right? If it's a maths problem, first simplify it and then solve it, right? So that's life as well. First simplify an issue and then solve it. So gender sensitization from a health perspective, a mental health perspective, is the same. So when we talk about all of this, when we talk about violence, we know that women are subjected to a lot of violence, right? The violence is social, the violence is financial, the violence is physical, the violence is verbal, the violence is sexual. A lot of women are, at least once in their lifetime, have faced one of these at some time, right? And every abuse is a psychological abuse. Because if tomorrow somebody even slaps me, which it won't stop, it won't hurt after 5 seconds, maybe, right? But the psychological impact of that, oh my God, I got slapped, is not going to go away anytime soon. If somebody gives me a bad word, yeah, it's a bad word, it's a word. It didn't physically hurt me, but psychologically it was there. So yes, there can be only psychological abusing, where people are undermining me, people are telling me you're not good enough, you don't know anything, you look horrible, whatever it is that they might be telling me to make me feel bad about myself. That's psychological abuse. But every other kind of abuse is also psychological abuse. And we know a lot of women who start having alcohol or other drugs, they will say that this happened because there was so much of abuse in their past. And we also know that domestic violence is a big problem. Domestic violence is not only about a spouse hitting a spouse, it's also about any family member being disrespectful and abusive towards another person. And women are the biggest victim of domestic violence, and intimate partner violence is a big thing. A lot of times you don't even have to be married to each other. You could be on a date and there will be an issue. And again, it doesn't matter whether you're binary, non-binary, and what kind of partnership that you have. Intimate partner level violence is a big problem. And that is a determinant for health and health outcomes also. So that's something that we do want to be aware of, that these are what are called red flags, and how, if something like this is happening to me, who do I reach out to? What do I say? How can I ask for help? How do I, even if I'm asking for help and if I'm not ready to take that help, what does that mean, and all of that. And at the end of the day, I am going to kind of leave you with this, that I talk about consent. I talk about consent with almost everybody. I don't post something on social media unless and until I have a consent from everybody. So if I take a screenshot of all of you beautiful people here with just your names, there are no photographs, or there is one person from the admin whose video is on, but even then, there should be, like, I will ask for organization, I'll ask Alima, oh, is this okay? Can I share this on social media? So consent is important at every level. And consent is important, and I need to understand that I should take consent and somebody should take my consent as well, right? And that's a right for everyone. Right? Even in the children in my own family, I will tell them that, can I get a hug? Or, I'm going to hug you right now. And, that kind of a thing. Give me a hug, things like that, instead of just going and like hugging a child or kissing a child. Not at all. And if my child doesn't want to be touched, it's okay for them not to be touched. It's perfectly fine. I'm not going to make them feel, oh, you don't want me to touch you. That's so sad. Now I'm feeling sad. I'm not going to emotionally blackmail my child into hugging me and touching me. It's perfectly okay, because that's how important consent is. Because when we grow older, that's going to become one of the major protections that one has. And I recently shared this joke in our National Symposium of Women's Mental Health of Indian Psychiatric Society, and I'm going to leave you sure, especially where men are concerned. The concept of consent and the understanding of consent is something that they still need a lot of work with, especially men, definitely especially men. Binary, non-binary, doesn't matter. Because, and the joke goes that most teachers are women, and we spend 12 years of our lives asking for permission before we enter, and we still don't understand consent. So with that, I'm going to stop talking for now, because I hope that there are some questions, but definitely also comments that will help me learn better, and after my session today, make me a better person and make me a better psychiatrist. So thank you so much for listening to me, and I'm a psychiatrist. Anything mental health, I'm okay if you ask me that question. Over to the admin.
Thank you, ma'am. Ma'am, I have some questions. Do gender stereotypes seem to be more offensive or incorrectly portrayed to females or males, or like both equally?
So gender stereotypes they impact all of us, right? But unfortunately, because of the way the world is set up, and especially the patriarchal setup of our country, it definitely damages and harms women more than men, because the gender stereotypes for men are more seen as positive and strong and advantageous, and the stereotypes of women unfortunately make them in fact in a worse position instead of in a better position. So though it impacts all of them, but yes, definitely this they are far more discriminating against women and non-binary people. Does that answer your question?
Yes, ma'am. Yes, ma'am. Can you suggest some takeaways?
So, like I started by saying that, right? That don't cry like a girl is no longer something that we are going to use ever. That's a promise that you have. All of us here have to make to ourselves, that we're going to not use expressions like this. That, oh, you're crying like a girl, or don't be such a girl, or don't cry like a girl, or don't be so gay. So we're not going to say we're not going to say that, right? And that's the first takeaway. The second takeaway is definitely see differences. You're a girl, or you're LGBT, or you're a boy, or you're a man, or all of that. You see people for who they are, and then recognize that that does not mean that I'm going to treat you differently. Like if you're a boy, am I going to say thank you? And if you're a girl, I'm not going to say thank you? No, that's not what I'm going to do. So I'm going to see, I'm going to acknowledge you, because if when I say that I don't see gender, somebody else might feel invalidated. But I don't necessarily have to ask them what are your pronouns. I don't necessarily have to ask them anything beyond I don't know, girl, boy, LGBT. I don't even have to ask them. That's all right. But but if they're telling me, or if they want me to do some, address them in a certain way, that's okay for me to do, because that's validating to them. So that's the second takeaway from here. The third takeaway is a bit of kind of like a homework. Go back home, think about it. In the last 1 week, what are the things that you read, saw in a movie or somewhere else that was gender stereotyping, positive or negative? Doesn't matter. So, when you're aware of it and you start looking for it, you might want to kind of, think about it. Like, let's say if I tell you that someone was driving a car, what image comes into your head? Was it a girl driving? Was it a boy driving? Right? Some things like that, simple things like that might give you kind of like more of an insight into how everybody else thinks. What other thing, again, like I said, one of the major takeaways is that knowledge is power. Get to know yourself a little bit better in terms of even simple things like, what is the requirement for my sleep? What is a nutritious food that suits my body? What is the kind of physical activity and exercise that I need to do? How much time do I need to spend by myself on a daily basis? Right? And another getting to know yourself is very simple. Who am I? Like, how do I even self-identify? When I think of myself, how do I think? In what terms do I think? Right? So another question is, what do I like? It could be, what's my favorite color, what's my favorite food, what's my favorite celebrity, what's my favorite social media. So getting to know more about yourself, right? Who are the 3 people in my life that I genuinely connect with? I mean, there could be 10, inshallah, hopefully, right? But at least name 3 people that you feel genuinely connected with, that feel you might not even meet them on a daily basis, but you feel connected to them. So all of this information is about self-awareness, self-knowledge, and that's going to empower you to be you. The trick about gender sensitization is that if I accept myself for who I am and recognize that the way I have different likes and dislikes, somebody else has different likes and dislikes, then it becomes easier for me to be more accepting, less judgmental, right? But a very important takeaway is also that I am so open to not judging other people, but I'm absolutely judging myself on a daily basis, right? So that's something that we definitely want to talk about also. That if I'm talking about equality, I'm talking about treating everybody equally, I'm talking about buying a gift for my friend that I like, that I would have bought for myself, things. Even today morning, there was a conversation with my mom that no, you can't give to somebody that you are not going to use. Things like that you must give to people what you would have used or you like, or, all of that. Not to say that, I don't have to keep the other person's preference in mind. But when we are going to treat each other equally, are you also treating yourself equally? Right? I'm okay to not judge other people, then why am I judging myself? Why am I saying that, oh, my nose is a little like this, oh, my color is a little like that, oh, I don't have these many marks, oh, I don't know how to talk to people. So you have to stop judging yourself the same way you don't want to judge other people, right? And improving empathy and compassion is going to be one of your strongest points as a human being, which is then going to build your resilience. And at the end of the day, ask for help. Whatever it is that you need help with, ask for it. If you're lucky and you get the right kind of help, alhamdulillah, very good, very nice. And if there isn't help that is available, you will still manage to do things because one has to do what one has to do. But asking for help gives you strength instead of making you weak. So those are my few takeaways. or giveaways. But those are definite takeaways for me because I believe in that and I try and live like that.
And ma'am, one more last question. As a mental health practitioner, how can we as psychologists aid in gender sensitization?
Okay, so as a mental health professional, what am I going to do? So on an individual level, what do I do? And on an institution level, what do I do? And on a community level, what do I do? And on a state level, what do I do? So there are different ways that one can help, right? We spoke a lot about on an individual level what I can do. Like even when I'm talking about when I'm doing my clinical work on a daily basis, I am going to ask the same set of questions to anybody who walks into my clinic for the first time. My intake form is not different for men and women or others. I'm still going to ask, oh, even if you're married, I'm going to say that, oh, are you straight, gay, bi, or others? So I'm going to ask these questions. I'm going to ask everybody past history of trauma in childhood or adulthood or present, like in the past or in the present. So I'm going to ask the same questions to everybody. I'm going to ask the same questions. Oh, do you smoke, do you drink, do you use other kind of substances? So on an individual level, I'm treating everybody the same. I'm definitely noting what you're telling me. And again, like I said, I'm going to recognize you, validate you, and then help you similarly. On an institutional level, if I do see a bullying of a certain kind, I'm definitely going to see to it that there are anti-bullying workshops and campaigns in a friendly manner without really calling one person out. Because if I see a bully bullying someone, there is that bully is probably getting bullied by somebody else. So if they're part of my institution, I can't segregate that person and discriminate against them saying that I don't like you because you were the bully. Yes, that's natural for me to not like and have an affinity to somebody who's being the aggressor, but that's also something that's also somebody that I can help, right? Whether it's a group of people, whether it's that one individual. And on an individual level, different things that you could ask is, like if you're hiring someone, don't ask them whether they're married, don't ask them if they have kids, because you don't ask that to a man, are you married or no, as much as you ask to a woman. Because a lot of the times when you're hiring someone, you're like, oh, she's not married, so you know what, if I hire her, she's going to get married next year and leave. So we only want to hire married women. Or if they're married, then like, oh, she doesn't have children, so you know what, she's going to go on maternity leave. So we are going to only hire women already with children. So these are again discrimination that we don't even realize that we may be even facing. So on an institutional level, those are some things that what we can do, right? And on a community level, if we do see, how girls are spoken to and how boys are spoken to, and how all of that happens, maybe we could kind of speak to them and all of that. And of course, if you are in a position, in a leadership capacity that you can impact policy changes, more power to you, and go ahead full-fledged, and you'll have a lot of us backing you up and cheering you on.
Thank you, ma'am, for answering all the questions. It was very clear. And as we have come to an end, I would like to thank you, ma'am, for your enlightening speech and for joining us. I hope everyone had a great time listening to you, and I extend my gratitude to the principal, Dr. S. Sri Devi, the Vice Principal, Dr. R. Meenakshi, and the head of the department, Mrs. Alima Zehra, and all our faculty members for making this conference a success. Last but not the least, I would like to thank every audience who have joined today and made this session beautiful. Thank you, everyone. Next, we have the valedictory session, which will start from 3 o'clock. So I request all the audience to start joining by 3. Thank you once again.